Hey everybody, it's Adam Farkas. Welcome to another edition of OD Wire TV. Now today we're going to talk about allergy, and specifically ocular allergy and ocular itch. And it couldn't be a more timely topic because here in the Pacific Northwest, out here in Portland, spring has sprung. It's allergy season here. I went out to my car this morning, which is usually blue. It was yellow because there's pollen all over it. The flowers are blooming. The trees are all green here, and you can hear it in my voice. My allergies are acting up, and many people have allergies here as well. But today we're going to focus all about ocular allergy and itch, and we're going to talk about specifically products that have made the leap from being prescription products to over-the-counter products. And I want to talk about this specifically today because you're looking at the screen right now where you see the Pataday line of products. And this is what we want to talk about today because they just made the leap not too long ago. Fortunately, today we have an expert here to discuss this with us. Dr. Francis Ma is a board-certified ophthalmologist specializing in cornea, cataract, and refractive surgery at Scripps Health outside of San Diego. But he's also the director of cornea and external disease at Scripps Clinic. So he's the perfect person to actually speak with us today all about this issue. And I want to also mention before we get started that Dr. Ma has been compensated by Alcon for participating in today's show, and this episode is sponsored by Alcon.
Well, thanks a lot, Adam. It's nice, to be working with you. Thanks so much for inviting me here. And you're absolutely right. This is an extremely timely topic and a very important topic, and also very, very exciting time for not only patients, but also eye care providers.
People don't understand, I think, the scope sometimes of allergy and how big it actually is. But again, I'll put up on the screen just so everyone can see what we're talking about here in terms of allergy. So the top 5 oral treatments for allergy, right? We all know them: Zyrtec, Flonase, Claritin, Allegra, and Benadryl account for over $1.2 billion in sales in 2016 in the US alone. So it's a big market, but not everybody who has allergy necessarily needs relief from rashes or congestion, right, that a lot of the systemic meds can give you. There are about 66 million people experiencing ocular allergies in the US each year. And these patients could benefit from something designed to specifically treat ocular allergy that acts quickly. And again, I just mentioned, of course, that the Pataday family is now over the counter. So maybe you could walk us through a little bit. How does having these sort of options help patients versus just the prescription products that were available previously?
Yeah, no, I think, you bring up an excellent point. The fact that, allergy is extremely common and it impacts our daily lives. But having access to these excellent medications sometimes can be an issue. So having the availability of over-the-counter or OTC increases patient access by several different ways. Number one is you really don't need a prescription. So you don't actually have to, for example, go see a provider or an eye care specialist. You can you can get the diagnosis, you can get the advice and recommendation, but then you can actually go to the pharmacy by yourself and you can make that purchase whenever you need, season after season or day after day, month after month. So you don't really need a prescription. You don't have to take the time or effort to call or to visit your provider. You can just kind of buy as needed. Number two is, as we've all had experiences with as far as prescriptions and insurance coverage, is you really don't need insurance approval or prior authorizations. That's a huge headache, not only for patients in terms of costs and improve in terms of formulary coverage, but it's also an issue for doctors' offices. We get calls daily on prescriptions that we've prescribed to patients. And for whatever reason, a medication may not be on a particular formulary list, and it may not be a branded medication, it may be a generic medication as well. And then there's cost issues, and some are covered in some parts of the country, some are not covered in other parts of the country. So the other issue is formulary coverage and insurance. You really avoid that issue as well. And then as far as the kind of waiting time, if you will. There is no waiting, as far as calling the doctor's offices, as far as calling the pharmacies to see if they have the stock and to see if they have the medication that needs to be filled. You can just go straight to the pharmacy and you can see it on the shelf and you can pick it up. With the Pataday family of products, eye care professionals have known about these products, Patanol, Pataday, and Pazeo, for years. And they have been the leading products as far as prescriptions written by eye care professionals for years. And now they're all available over the counter as Pataday. And they can be bought wherever eye care drops are sold. They're available at an accessible price. It's typically less than the average prescription copay. As eye care professionals and patients who've ever used any of the Pataday products, we know that they work very quickly, usually within minutes. Some of the issues about ocular allergy, as you've already mentioned, is there are many, many products that are over the counter, and many, many patients are buying systemic medications, but it's actually only about 10% of ocular allergy sufferers that use over the counter ocular allergy drops. There's a lot of work to be done to help patients understand the importance of treating eye allergies at the source.
Right. Now, you mentioned something important there, and people can see it up on the screen as well. Only about 10% of ocular allergy patients are using these over-the-counter drops. So that's not great.
No, it's really not. The over-the-counter medications are there, and like you said, many patients are using systemic medications, but they really have not started using the over-the-counter allergy eye drops. Going to really benefit the patients. Honestly, cost is also going to be there as well. So I think the education needs to kind of go out there as far as the fact that topical medications are there for ocular allergies, and the fact that ocular allergies really are extremely common and a common reason for patients to call eye care providers as well as primary care physicians.
Right. And so I guess, as providers, what can the provider, seeing those low utilization rates, what can you do to try to make people more aware of the fact that this modality is out there and should be used?
Yeah, I think there's a couple of things. I think the two big areas are communication and education. And communication, I think there's two facets. One is, we need to be discussing to the patients the fact that these are available. At the beginning of the allergy season, for example, for these patients to come in, they're having symptoms. They may not know exactly what symptoms there are. But as far as the medications, to kind of educate and to tell the patients that there are over-the-counter medications which are available, which can greatly benefit these patients. But then also to get our staff on board as well, the technicians and the office staff, the phone people. I think it's really important that the staff from the eye care providers down to the receptionists feel really comfortable making those recommendations that the drops are now over the counter, their prescription strength, and directly to them, either locally or online, they can get the drops at their convenience. Number two is listening to the patient. So it's not only us discussing as eye care providers to patients, but it's also listening to the patients, finding out their needs. How successful have they been in managing their ocular itch symptoms? Patients who have not been able to address their ocular allergy itch symptoms in the past with over-the-counter options may be open to trying different treatments. And now they can get a prescription strength option. And actually, again, the number one selling option as a prescription, now they can get it as an over-the-counter product. And then the second aspect after communication is education. And what we need to do is we need to explain that over-the-counter options can really help them out. There are patients who don't really know that there are eye drops that are available to treat their eye allergy itch symptoms. And eye care professionals can really help them understand the benefits of treating their symptoms at the source, at the eyes with topical medications, and recommend over-the-counter options that can do this. There are a lot of boxes on the pharmacy shelves. I know that patients get mixed up between contact lens solutions and artificial tears, but making a recommendation is really necessary to cut through the noise that the patients are experiencing at the pharmacies on the over-the-counter shelves, and really help make sure that the patients are choosing a product that will meet their needs. So talking to the patients about over-the-counter options, it can take a couple of extra minutes. The practices can really benefit from the recommendations of Pataday over-the-counter products for ocular itch as well, because they're providing a trusted formulation that eye care professionals are very familiar with, very comfortable with writing. It saves time for the practice, because again, there's less of the pharmacy communications, insurance communications, prior authorizations. There's no insurance paperwork that needs to be required, and we're providing the same quality of care. It's a couple of extra seconds that we need to say, but we actually save time, effort, and make our patients happy on the back end.
Right. Cutting down on the paperwork is always a good thing. So,
oh, definitely.
Yeah. And one of the interesting things, though, since we've seen this transition now from prescription product to OTC, is that I've seen ads, and I've gotten actually, pieces of paper from different companies saying drugs like Pazeo being sent to the patients where they say, you're not going to be able to get this medicine anymore. Like, it's a crisis. And, oh gosh, what are you going to do? You're going to have to use something else. Right. Obviously the unstated message that they don't bring up, right, is that the medicine is still available, just as a different product. So I find that really interesting, that this is a strategy that some competitors take in the market when a drug goes from being prescription to over the counter.
Yeah, no, I think you're right. I think it's an interesting strategy. I think it benefits the patients. Sometimes you're right, it can be a little confusing, especially when the names get changed. But I think a little bit of education, and the patients, really appreciate that couple little extra seconds when, a provider or the staff or the receptionist just tries to educate, and really, save the patient time and effort and money as well.
Yep. And, I mentioned earlier, I put up the chart on the screen so people could see it, that about 66 million people have ocular allergies in the US, which is a fairly significant number. But in your practice, what do you see? How significant is ocular itch, on a day-to-day basis in your clinic?
Yeah, so ocular itching is an extremely common symptom that patients will come in with. And in fact, when I have a patient that comes in with itching, or itchy eyes, the first thing that always pops into my mind is actually eye allergies or allergic conjunctivitis. That is the one symptom that kind of has to be present in order to make that diagnosis of allergic conjunctivitis or eye allergies. If a patient actually does not complain about itchy eyes, then I really kind of put eye allergies or allergic conjunctivitis kind of as a second possible diagnosis. It's not that all itchy eyes are allergic conjunctivitis or eye allergies, but in order to have allergic conjunctivitis or eye allergies as a diagnosis, itchy eyes really needs to be present. It's also the most frequent reason that allergy patients actually seek treatment is that ocular itching. And like you said, more than 66% of ocular allergy symptoms, are there, but they're really considered bothersome or really, a huge issue for patients. So those ocular allergy patients who suffer, they're really bothered by eye itching. And again, 2/3 of those patients really think it's extremely bothersome to them.
Right.
And then as far as the negative impact, we know that there's a negative impact for ocular allergies and their symptoms.
So I guess we should drill down a little bit now and talk a little bit about the Pataday family of OTCs. So let me pull it up on the screen again so people could see. You can see the little bottles or the little boxes that I have right there. So Pataday is now a happy family here of OTC products. So maybe step us through each one and how each are useful.
Yeah, so I think as eye care providers, as people who see patients with ocular allergies and eye allergies, allergic conjunctivitis, we've kind of known the drug olopatadine for years, and we've known olopatadine in 3 different concentrations with 3 different names. And I think it's kind of clever, if you will, that Alcon has tried to really simplify the olopatadine family for patients as they moved to over-the-counter or medications without a prescription. So the first one that we'll talk about is Pazeo, which was the prescription name. It's now Pataday Once Daily Relief Extra Strength. And it's the first and only 24-hour ocular allergy relief drop available over the counter. It has 0.7% olopatadine concentration. So again, the extra strength once a day Pataday is the first and only 24-hour ocular allergy itch relief drop available. And then we move to Pataday, which is now Pataday Once Daily Relief. So Pataday was the prescription name that we recognized as eye care providers, as patients, and now it's Pataday Once Daily Relief. It's the first once daily ocular itch drop available OTC. It was the first one. It has 0.2% olopatadine concentration and provides relief of ocular allergy itch for up to 16 hours. And then you've got Patanol. So Patanol is now known as Pataday Twice Daily Relief. It has 0.1% olopatadine concentration and temporarily relieves itch and redness due to allergies for up to 8 hours. So the Pataday products, they work quickly to relieve ocular allergy itch. There's 3 different concentrations and 2 dosing schedules, which give patients various different options for their itchy, allergic eyes.
Excellent. And I'm very thankful to Alcon for doing this, because I could never remember without actually looking it up, the concentrations of each. And I'm sure I'm not alone, right? But with the more descriptive names, that definitely makes it easier.
Yeah, and I think it helps the patients, as they're kind of looking over the counter, they can either escalate or they can just kind of go to the one that they feel is going to be the best for them.
Yep. And maybe so for people who might have forgotten about olopatadine, we've been out of school for a while, maybe we should run through a little bit about how it works and its mechanism and how it actually does help with allergy.
Yeah, absolutely. So olopatadine actually was developed specifically for ocular allergies. It was the first, medication which was developed specifically for ocular allergies. I think just as you said, kind of going backwards, allergens bind immunoglobulin E antibodies on mast cells. That's kind of the key interaction that occurs in any type of allergy, and especially in ocular allergies. This binding of the allergen to the immunoglobulin E antibodies on mast cells releases histamine and pro-inflammatory mediators. Obviously, we've all heard of histamines and then antihistamines. The released histamine then binds H1 receptors on neurons and blood vessels. The impacted neurons results in the itching, and then the affected blood vessels results in vasodilation and redness.
Got it. And so what does olopatadine actually do to stop that mechanism from happening?
Yeah, so olopatadine has a dual mechanism of action, and it blocks the ocular allergic response at the source. So it prevents the release of histamine and pro-inflammatory mediators. We kind of call that a mast cell stabilizing effect. And then number 2 is it selectively blocks binding of histamine to the H1 receptor and activation of the allergic response. So not only are you going to prevent the release of histamine and pro-inflammatory mediators, but even if you've got some histamine that's been released, it's actually going to block the histamine binding to the H1 receptor, and therefore some of the effects from the allergic response.
Yep. And so, now that we kind of have an understanding of how they work, maybe we should just, talk about how effective they might be at this, relieving the specific symptom of itch, right? I guess, which is what we're here to talk about. So maybe we could talk about sort of each one of the formulations one by one, and when you might even want to use them.
Yeah, no, that's a great point. So we've talked about what olopatadine does, how it works. We've talked about the various different Pataday concentrations, and then the kind of efficacy. So, as far as Pataday once day relief extra strength, it demonstrated fast onset of action and a duration of activity of 24 hours. 24 hours with one drop, and was significantly more effective than placebo at all time points. As far as Pataday once daily relief, that demonstrated fast onset of action and duration of action up to 16 hours and was significantly more effective than placebo at all time points. And then we go to the third drop, which is Pataday twice daily relief. And as far as this provided faster ocular itch relief and a greater reduction in ocular redness than oral loratadine, 10 milligrams.
Yep.
As far as when you might want to use them, they've established obviously a very, very safe profile. As far as when you might use them, Pataday twice daily relief. That would be, in patients who have occasional, symptoms. You can kind of use that as an on-needed basis. As far as Pataday once daily relief, it would be patients who maybe don't have symptoms at night, and mainly it's just during the daytime. And then obviously the 24 hours. Pataday once daily relief extra strength. You would use that if you do have symptoms and occur all day and night.
Yep. And you mentioned safety profile just a moment ago, and maybe we could talk about that a little bit, because these drugs have been around for quite a while in prescription form. Now they're OTC, but maybe you could just catch everyone up again on the safety profile and what they should look out for.
Yeah, sure. That's a great point. First of all, we always want to know about the efficacy. Second thing that we always want to know about is about the safety. So as far as the safety profile, I mean, they've been around for years, as we've already established. They've got an excellent established safety profile in the real world use of Pazeo, Pataday, and Patanol. The three most frequent adverse events in Pataday once daily relief extra strength were blurred vision, which happened about 4.8% in their clinical trials, dry eye, which occurred about 3.3%, and then corneal staining, which happened about 2.4%. In the pooled data from 9 different Pataday once daily relief clinical studies, there was only one ocular adverse event that occurred in at least 1% of Pataday patients, and that was ocular pain in 1.1% of the patients in the clinical trials that were pooled.
So, we talked a little bit earlier that the sort of use of OTC products for ocular allergy is rather low. I think that's an understatement. You have any other sort of suggestions or tips that you can give out there to folks who might be watching to really try to engage their patients and get them to start using these products?
Yeah, I think I think number one is really to try to communicate, to listen to the patients, what their complaints are, and then number two is to try to educate the patients. Again, to just take a couple of seconds just to say, that these symptoms can definitely be problematic, that they are significant, and they can definitely impact lifestyle. That the three, this is what I say, the three most popular to date are now over the counter. So, that kind of, I think, relieves some of the stress from patients. If you go over the counter, maybe it's not strong enough to control my symptoms. So you can, tell the patients these were prescription, now they're over the counter. There's 3 different kinds. There's Pataday twice daily relief. There's Pataday once daily relief during the day, and then there's Pataday once daily relief extra strength. And so the patients, I think, are very relieved that they can get something that's prescription strength, but it's over the counter, and they can avoid the whole insurance hassle, and they can kind of buy them when they need them. So I think just educating, just taking that time, just kind of feeling, that sympathy or empathy for the patients, that, if this patient was my son or my daughter or my wife, my husband or my parents, I would want them to use this medication very simply, and just be able to go over the counter and buy something that used to be prescription strength. I think those are kind of the thoughts that we need to have when we're trying to educate our patients.
Yep, and I think patients are probably primed for that message already, at least in the field of allergy, right? Because they've seen that happen with the systemic meds that they may already be familiar with.
Yeah, you're absolutely right. I mean, some of the most common and most popular medications that were prescribed are allergy medications. And, historically, I think over the past decade, 2 decades, we've seen the release and launch of over-the-counter medications that used to be systemic prescription medications. So I think the patients are aware that they can get, over-the-counter medications that used to be prescriptions.
Absolutely. Okay, great. Well, Dr. Both, thank you for this. Do you have any sort of, closing words of wisdom or words of advice for everyone out there?
Yeah, no, I think just, I'm very happy that the over-the-counter medications have been launched by Alcon. I think they did something very clever by making it very easy for providers and patients by, kind of giving that Pat-a-day name, but doing it twice a day or once a day relief or once a day relief extra strength. The fact that we have various different concentrations for the various different needs of our patients. I think we should all be recommending Pat-a-day formulation for the patients when they're going to have ocular itch. And we've got the formulation that's going to meet the patient's needs depending on their symptoms are or when they have their symptoms.
Excellent. Well, thank you so much for joining us today and sharing this great advice with us.
Yeah, thanks a lot, Adam. I really appreciate you asking. And I think this is, like you said, a very timely topic and a very important topic.